Welcome, guys. Just a heads up, we are recording. Before I get started, I'm just going to start off by acknowledging the traditional owners of the lands we're all dialing in from. I'm on Wadawurrung country today, and I'd like to pay respect to elders past, present, and emerging, and extend that respect to any Aboriginal or Torres Strait Islander dialing in with us today. You are here for the Introduction to Practice Leadership program, and this is the Know Your Numbers activity where you're all going to go and do a bit of work within Polar to have a bit of a review of your practice data and choose something to do a quality improvement activity on. Now, don't worry, we are going to be here to help you along that process. And the digital health team and the practice facilitator team will be available for any questions, or if you want a practice visit and we can come and sit down and do it with you. There'll be plenty of support available. Just to be clear about this session, this is an interactive session, so please feel free to come off mute and ask a question or pop any questions that you might have in the chat. As previously mentioned, we are recording, so if you're desperate to not be in that recording, welcome to turn your camera off. I won't be offended for this session, but we'll share that recording with all of you. And I'll mention this several times today, but you can absolutely reach out to your practice facilitator or to one of us in the digital health team at WVPHN for support in completing this activity. So before I get started and show you what the workbook looks like, I just wanted to do a quick shout out that you all have access to Polar. We have checked that. If you don't know what I'm talking about, that's a data extraction tool that I'm about to show you how to use. There is a link on the screen there if you're not sure how to access it. And every organisation that has Polar has an admin user set up. It might be your practice manager, it might be your owner, but basically that person has access to add as many user accounts as they need. So if you're not sure how to access Polar, find out who your admin user is and they can add you. And if you're not sure, get in contact with us, the digital health team, and we can help you find that as well. And just letting you know that to have a Polar account, you do need an individual email address, hopefully a work one. And you also need to pop in your mobile number. That is not for anyone to contact you. It's just for multi-factor authentication because the information sitting within Polar is very private to your clinic. So I'm actually going to give you a little look at the workbook. So tomorrow morning, all of you are going to get an email with a copy of this workbook. And the idea is that you complete this workbook using Polar by the 28th of August. I've popped in some of the instructions up here that you'll be able to you'll have access to. And we're going to do 2 data collections throughout this program. So we're going to do one in the next few weeks. Then you're going to do a PDSA or a quality improvement activity on something that has stood out to you within your data. And we're going to come back and do another data collection, the same thing again by the 17th of October, and see if we can notice any changes, see if you can see any changes within your data. It's going to do a number of things. It's going to give you a lot of confidence in using Polar to review your own practice data. And it's also going to help drive quality improvement activities that you might want to do and help you review whether it's your data quality or your clinical care quality. So this is what the spreadsheet will look like. Obviously, by the 28th of August, I'll be asking you to complete data collection 1. I have done you a favour, and anything where you've been asked to calculate the percentage of something, I've popped in a calculation that will do that automatically for you. Hopefully it works. But you're basically going to be using Polar to go and find out most of this information. There's a couple of things at the top here that you'll need to fill out yourself, and that is your number of FTE GPs, nurses and admin staff to give you an idea of what your full-time equivalent is like. But the rest of it you'll be able to find in Polar. We're going to look at how many active patients you have on your best practice medical director or ZMed, what the age groups of your patients look like, how well you're recording some of those minimum data sets, most of which are part of accreditation anyway. You're going to be having a look at how many patients in your clinic have different specific chronic conditions so that you're aware of what the most common conditions are, how well you are doing minimum care standards for your diabetic patients, and how they're going with their HbA1cs, where do they sit. We're going to have a little look at COPD and whether they have patients with COPD and whether they have a BMI recorded. We're going to look at how your immunizations are going, whether you've got the right data sitting in patient files for older people. And then we're also going to have a look at who's eligible for care plans that have specific conditions as well. So that's the information we're going to be looking at. And I'm just going to open Polar now. I'm going to be swapping between this sheet and Polar just to give you a heads up so that you can see how we're going to find this. The first thing I want to find is how many practice active and RACGP active patients do we have? Now, before I share Polar, I am going to launch a quick poll that I almost forgot to do. So a little question is going to pop up on your screen, and I'm going to ask if you can just select something. It might be, you might need to ask a couple people in your room and average it out. But just if you can let me know how confident you are in using Polar. Hopefully that's popped up on everyone's screen. And I want to know how confident you are. Give it 1 sec. Still got a couple of answers coming through. It looks like the majority of people in the room have either used it a little bit or have never used it before. So it just helps me knowing where to start and how much detail to go into. I'm just going to take a very quick screenshot. Alrighty, yes. So majority of people have either used Polar a little bit or have never used it before. I'll just share the results very quickly so you can see where the room is at, and I'll check in at the end and see how you're feeling about doing this activity. Alrighty, so I am going to share Polar. Looks like most of you will be relatively familiar with this, except for those who have never logged in before. This is what Polar looks like, and what Polar does is it sits on your server and it extracts all the data out of your patient files and populates them into these reports that are really useful for you to use and be able to review your own data. So this is what it looks like when you first log in to Polar. You'll see there's a number of webinar recordings, and if there's any upcoming webinars, they'll be posted here. They're free. You're very welcome to attend those or watch those recordings. But the first place I usually direct people to go is to go and have a look at your reports. And you'll have different reports to me, but I'm going to go into the clinic summary. Now, just calling out, this is all completely fake data. It's a fake clinic with fake patient files. I believe it's called Chocolate Chip Clinic. So everything you see here is just for demonstration purposes, but this is exactly what you will see in the clinic summary. I can see on this page that there's 87,927 patient files sitting in my best practice. I can see that 42,500 of them are marked as active. Is there anyone brave that would like to come off mute and tell me what they think RACGP active means? What's the definition of RACGP active? Non-PHN people. Anyone brave enough?
Sarah, we reckon it's within 2 years.
Yeah.
Do you know how many?
3 times within 2 years.
Spot on. I'll give the point to both of you. It's if the patient has attended the clinic 3 times in the last 2 years, they are considered RACGP active. So it's two different definitions. They're either practice active, which is purely are they marked active or not in best practice or medical director or ZMed. And then there's also RACGP active. It's two separate definitions that might be used for different purposes. If you are sending out an invite to patients who are in their 40s for a health assessment, you might want to include people that haven't been there 3 times in 2 years because you're trying to engage that cohort that may not have attended. However, if you're reviewing how well you're recording certain quality measures, you might want to focus more on people that are attending the clinic regularly. So that's where you would use RACGP active. For the purposes of this program, for this Know Your Numbers activity, and for the Introduction to Practice Leadership program, we are going to focus on patients that are both. So we are always going to be looking at patients that are both marked as active in your software and have attended the clinic 3 times in the last 2 years. So lucky in Polar on this homepage, there's actually a box I can tick to select both of those filters. There is another way. If I go into all the millions of filters that are available to me within Polar, I can actually select both of those as well. So I select it, give it a tick, and you'll see it pop up into my filter bar and all the graphs change. And I'm also going to put on RACGP active and give it a tick. And you see it's automatically ticked that box I could have just ticked. And I can click these 3 dots to hide that set of filters. So now I can see that there are 12,021 patients that fit both of those definitions. So what I would do, what was it, 12,021? I'd go and put this in here. First measure found. This is what you'll be doing with your own data. The next thing I want to do is see a breakdown of how old those active patients are. I'm going to show you how to do that. If I go up to the patients report, you'll see there's a whole lot of different reports available to me. I'm going to go to patients and select patients. And that gives me a really nice breakdown of how old my patients are, where they live, what their Indigenous status is, their pension status is, and DVA status is. And we're looking at age group. Now, all the graphs in Polar are interactable. I can click on things and use that as a filter. So you might remember in that spreadsheet I just showed you, I actually want to know the total of anyone that's 0 to 9. So I could sit here and add them up. I have to admit my maths is not that quick. So I could also just select those two and give it a tick. And it's going to tell me 1, 2, 6, 3. That's how many patients are 0 to 9. So I'll go across. Now I can't remember what the number was. 1, 2, 6, 3. So 0 to 9 is 1, 2, 6, 3. That's how many patients sit in there. I'll show you one more time for the 10 to 19s. So at any point, I can get rid of a filter. You'll see everything refresh. And now I want to know what the 10 to 19-year-olds. So I select both of those and give it a tick. The filter comes on, and it gives me the total number of patients, 990 patients. So I go over here, and I'm going to pop on 990 patients. I won't show that again. I think you get the idea. I'm not going to go through all the age groups, but you get the idea of figuring out where different age groups sit. And I guess the benefit of this for a practice is to have a look at what sort of services we might need. Now, bearing in mind this is a fake clinic with fake data, so it may not be reflective of someone's real data. But what you might see looking at this is an indication of what sort of services or skills that your staff and your practice might need to prioritise. If you've got a a much larger aging population, you might really focus on making sure that all your staff are confident in how to book and deliver and follow up on 75 plus health assessments. If you've got a higher proportion of younger families, you might want to focus more on childhood immunisations or have a maternity nurse, or you can see what I'm saying there. It might have an impact on the sorts of things you want to prioritise as a clinic. If you've got a big lot of 45 to 49-year-olds, what an opportunity to make sure that you're delivering those health assessments and getting the most you can out of those preventative health assessments. All right. Any questions on that so far?
I just wanted
No.
to double check. Sorry, is this the data that we're extracting is based on the patient and the ICGP active patients only? Not yet. Cool. Just wanted to
That is
double check.
correct.
I nicked off for 2 seconds to get a drink of water, and you might have said that already, so I just wanted to check.
No, that's okay. Absolutely. It's a good reminder anyway, Kelly. We're only going to focus on patients that are both practice active and RACGP active. All right. So the next thing we're going to look at is a couple of quality measures. How well are we recording the things we should be recording on our patient files, like allergies, smoking status, family history, social history, and BMI, and we'll have a chat about that. It is asking for a percentage, but the beauty is within Polar, it's going to show us that anyway. So to find the quality data, you're actually going to navigate up to patients and funnily enough, go to the quality report. This is a nice visual report that's giving you an idea of how well you're recording all of those measures. It's also comparing it to the RACGP standards for accreditation and what you should be aiming for. So if I have a look at this chocolate chip clinic, I can see that we've been recording age and gender and postcode and Indigenous status really well on our RACGP active and practice active patients. What I might choose to work on is emergency contact, or alcohol, or BMI. And it's giving me the percentages here. So I can see that I think one of the first measures was allergies. And I can see that for allergies, we've recorded 96.43%. 96.43. That's where I can get that data from. What percentage have a smoking status recorded? La la la. I think 77.71, which is above the minimum requirement for accreditation. 77.71. That's where I can see that. I'm going to do a quick shout out about family history and social history. All right. People might get a bit worried because they might have a look at their social history and family history and go, oh my goodness, we've got barely anything recorded. And whilst it is a good thing to try and improve, I am going to let you know that across Western Victoria, in fact, across the country, we see really low rates of those things recorded. And there's actually a good reason why. I always talk about, you know, GPs and nurses didn't become who they are so they can record data for us. That's not the aim of their jobs. So if recording the data is not particularly useful in them treating that patient, then it may not be recorded well. And in my opinion, happy to be challenged, that's okay. You might find that social history is not very well recorded at all. And I'll show you why. The beauty of Polar is that I can always find out where is it getting this data from? Because I thought I was recording that pretty well. And I can actually go help data mapping for this page. Where is it pulling that data from? It is going to make me log in again. Hopefully I've got the right details there. Yep. And it's going to give me some information about where it's pulling the data from. So if I go down to the quality measures and I pick social history, and let's say I use best practice, which about 85% of practices in Western Victoria do use. It's going to tell me exactly where it's pulling the data. So if any of one of the below are recorded, the indicator will be set as recorded. So if they've got a marital status, sexuality, whether they've been ticked as an elite sports person, and this is where we're looking in best practice. So if they look in social history and one of these things is filled out, marital status, accommodation, then it will be ticked as recorded. And what we see is that's not recorded very well, and probably because it's not overly useful to the GP or the nurse seeing the patient, and they're not going to go look there. It hasn't been well utilized. So I guess what I'm saying is don't worry if that's a measure that's low for you. It's quite common. And I can do that for any of the other measures if you're not sure where it's pulling that data from. But that's basically, it's very similar for family history, and you'll notice for physical activity is exactly the same. It's not fields that are well used in your software, and that's why it's going to come up as low. Any questions about the quality measures, the data quality measures? No? Okay, awesome. So that's where you, just again, patience and quality is where you're going to find those quality measures. What's the next thing we're going to look at? I'll just check BMI was, yeah, it is on that page. All right, the next thing we're going to do is we're going to go have a look and figure out how many patients have diabetes, COPD, asthma, etc. And this is looking at our chronic disease prevalence within our patient base. So again, I'm going to leave on my active filters, and I'm going to navigate to clinical and choose diagnosis. This report is super cool. I'm going to explain why it's showing you several sets of data. This is the same data presented in 4 different ways. Okay. On the very left, we're looking at the diagnosis box that's on your patient files, all the different ways that the GP has entered, or the GPs have entered diagnosis in that diagnosis box. But what you might think is, or what you might need to remember is, sometimes people write diabetes different ways. Yes, of course, we hope that people use the coded version, which means double-clicking and choosing from the drop-down box. But for a multiple plethora of reasons, that doesn't always happen. It might be historical. It might be that what you're looking for isn't on the list, or you want to be more specific. We do encourage you to use the coded double-click and choose one, but if you can't, sometimes you can't. But this will all be captured within this GP diagnosis version of the data. What Polar does is they've got a team of clinicians and people that have mapped that data to what's called the SNOMED text, which is the name of the coding convention that we use in Australia. It's the most preferred one, I would say, and that's going to map all of them to the coded version of the diagnosis. And Polar, even further, then maps those into a chronic disease category if you want to look from a higher level, but also from a higher order group. Now, I'm going to give you an example of this. If I click on diabetes as a category down here, you give it a tick. You can see this is the category broken down into the 3 different coded versions of diabetes, and then further broken down into the way that the GPs at my clinic have entered that information. And it's quite common to see quite a lot. Some of them might have been entered 30 years ago. It depends how old your database is. It's quite normal to see lots of different versions of how diabetes has been recorded. But thanks, Polar, you've mapped it for us so we can have a look at the total numbers. Now, the first question on our Know Your Numbers spreadsheet was how many active patients have diabetes, all types. And I can see it right now that there's 848 patients. So I'm going to go record that in my spreadsheet. Now, because of the calculations I've put in, it's automatically, I'll fix how many decimal points that it includes and make it less, but it's giving me my prevalence. What percentage of those patients is it of my total active patients? Next one is COPD. So I'll get rid of the filter I just put on that tells me diabetes. And now I want to find COPD. Now, COPD is not one of the categories I can pick. So my next best option is to go and pick from SNOMED text. So if I start typing, it's going to come up. Give it a tick. And so it's showing me again the different ways it's been entered into my diagnosis. It's worth having a look to see how many different versions of it there is. But I can see the total is there's 138 patients that have COPD. Go back to my spreadsheet and pop it in. I am going to do one more, asthma. Actually, no, I'm going to skip asthma. I'm going to do ischemic heart disease, because that might be a tricky one to find. Give it a cross. So get rid of the COPD. Ischemic heart disease, there it is. Give it a tick. 162 patients. I go back, I'm going to pop in 162. I'll check my calculations before I send you this because it seems to not be working. Any questions about finding your chronic disease prevalence or that report? Nope. Excellent. Pretty happy with that. I have popped in some data that we found around what is the prevalence in Western Victoria and what is the prevalence that we're aware of nationally, just so you can sort of compare and see how you compare to the rest of the country or Western Victoria. There might be reasons that it's different, or it might just be luck. But again, this might inform what sort of services or skills you need within your practice to provide the best care to your patient cohort. You might identify that you actually have quite a high prevalence of schizophrenia or bipolar and realize that maybe some of your staff, whether it's front desk staff or whether it's your clinicians, might like some upskilling in that area, or understanding what the best practice treatments are coming out these days. You know, it might guide some of that for your practice. Moving down to diabetes care, we're going to get real nerdy with the data now. So we're going to start off by making sure we select all our patients that have diabetes. You already know how to do that, but I'll quickly do it. We happen to still be in this report. I'll get rid of the last filter I put on, and we're going to pick, I can use the category here, diabetes. Give it a tick, and it adds up there. Now it's going to start asking what percentage of those patients have had their HbA1c tested in the last 12 months? What percentage have had their cholesterol checked in the last 12 months? And how many have had blood pressure, ACR, BMI? Let's go and see if we can find out. Luckily, although the item number and the service incentive payment was discontinued, there's still a report in Polar. I go to MBS and go diabetes cycle of care. I'm well aware the incentive payments have gone, but we can still look at the data for how well we are recording things in the last 12 months. So this table here on the right is telling me what percentage of my patients with diabetes have had that measure checked in the last 12 months. So for blood pressure, it's telling me 48% of my patients with diabetes have had that checked in the last 12 months. So 48%, I can go blood pressure, 48%. Cholesterol is on there. If I look for cholesterol, I can see that 72% of my patients with diabetes have had that checked in the last 12 months. I can go and pop in 72. And HbA1c is in here. There it is. HbA1c, 73% have had that checked. So you can go and review that for your own data. BMI is also in there, as is ACR. This is where we're going to get nerdy. Now it's actually asking me, well, of your diabetic patients, how many of them have got HbA1c readings in different areas, in different levels? So I'm going to introduce you to a whole new report and totally rock your worlds. If I go back, if I ever want to go back to the start of Polar, I can just click the little polar bear. It'll take me right back to the start. And I want to go look at web report. I now want to have a look at what's called the QIPC report. You will have one too. Mine says demo because obviously it's all fake data. You're going to go look at your QIPC report. In here, there's some care quality measures and reports that you can access. There's quite a number, and it's all about quality improvement in primary care. And there's actually a diabetes report. If I go to clinical, go down to diabetes, it's going to show me some information about my patients. And it's already going to tick RACGP active and default to active, so you don't have to put those extra filters on. However, it is going to show me how my diabetic patients are tracking in terms of their HbA1c. So those that are less than 7 are represented down here. Now, the latest is the purple box. And you can see it's comparing you to the whole pH, to all of Western Victoria practices. So I'm going to take the purple measurement, the latest one. Purple, and look at less than 7. It's telling me 42% of my diabetic patients have a HbA1c reading of less than 7 in the last 12 months. So I can go and put that 42, less than 7, 42%. Between 7 and 8, did tell me, is 18. See that there? Between 7 and 8, 18. I can go and pop that there. Between 8 and 10 is 9%. More than 10 is 3%. And then it's asking me how many have not had it done in the last 12 months. 28%. That's my diabetes care quality. Or HbA1c management. It might not be care quality, it's just how they're tracking with their HbA1cs. Any questions about the diabetes care? Nope, I'll keep moving. I now want to know how many of my patients that have COPD have a BMI recorded. I've just realized I've got to show you something. COPD with BMI recorded. We're going to start moving between reports now. So you might remember we go to reports and we're going to go look in clinic summary, where most of the time we're going. So what I might do in the interest of time, no, I'll show you this. So I'm going to pop on my active filters, so I can just tick this box. I'm going to go find out who were my COPD patients. COPD. Give it a tick. Something I forgot to mention before is a diagnosis can be active or inactive, right? For some diagnosis, people might no longer have that diagnosis. It's probably rare, but it happens. So you'll notice that this is showing me active diagnosis and inactive diagnosis. Now, for most of the chronic conditions, it shouldn't matter too much, but just to let you know, at any point, you can go and put this filter on. So if I go and look at all the many filters that are available to me, there's a diagnosis filter saying I only want to view diagnoses that are active. And that might change your numbers. Give it a tick. So it's actually only 130 patients that have an active diagnosis of COPD. And now I want to know who has a BMI recorded. So I can go, if I go into patients and have a look at the risk factors for this cohort, here you're going to see a whole lot of interesting information around their risk factors. Who's got high blood pressure and who's got none recorded? What are their smoking statuses for those 130 patients? And whether they've got BMI recorded or not. Now, the question I was looking to answer was, how many of my patients, active patients that have an active diagnosis of COPD, have a BMI recorded? And just to show you how easy it is to interact with graphs in Polar, I can select all of these, anyone that's got one recorded, and give it a tick. And it's 86. 86 of those 130 patients have a BMI recorded. And that's where I might have to go 86 over 130. Let's do this first. 86 over 130. So 66%. All right, I'll keep moving because now I'm going to show you how to use the clinical indicators report, which is going to help you complete pretty much all of these measures here. So the first one is total number of active patients that are over 65. Well, actually, that we already know how to find. So I'm just going to clear some of my filters. We'll take off COPD, BMI. I might leave the active diagnosis on. So we wanted to have a look at how many patients over 65 we have. I could actually just go and select all of these. But there's another way. There's always several ways that you can find data. I'm actually going to go into what's called the clinical indicators report. This is my favorite report. It's super powerful and you can find so many different useful things. So this is a report where you can put on as many inclusion filters and exclusion filters as you like. And I find it most useful when I'm using this report to say it out loud. So bear with me as I do that. So in inclusions, I want to include only patients that are marked as active in the software and RACGP active. It's already popped them on for me because I already had those filters on. I also only want to look at patients that are 65 and over. So I can go to age or over 65. And you can select a whole bunch or you can just do this. Oops. And hit enter on my keyboard and it's going to select all of those ages. Oh, it hasn't selected 65, but you get the idea. You'd maybe put in 64. So if I have a look up the top, it's telling me there are 2,360 patients. That's my total, 2,360. Total number of active patients, 2,630. What percentage of those patients have a BMI recorded? Yeah. So again, you could go into the risk factors and select that, or we can stay in clinical indicators because I want you to get confident using this report, and we can choose it here. So including patients that are active, and 65 and over. And then if I go into clinical measures, I untick this and untick this. I just want to look at clinical measures. There's BMI, and I want to know who does have a BMI recorded. So it was these ones. If I select everything except for recorded, not recorded, give it a tick. 1519. 1519. What I'm going to do actually, apologies everyone, is fix it up so that you just put the number in and it will automatically calculate the percentage for you. I'll fix that up before I send this to you. Now we want to know how many have had a pneumococcal vaccine. So I'm going to go have a look. I can get rid of the BMI filter I've put on. But what I'm going to leave is my other filters because I still want RACGP active, practice active, still want the age group. And I mean, we can get rid of diagnosis active. It shouldn't change anything, but I'll get rid of it to be neat. Now, who has had a pneumococcal vaccine out of this group? So I can go to immunizations. And Polar do a nice thing where they do group vaccines together from different brands. So I can go and have a look at, oh, can't spell pneumococcal, give it a tick. So it's including patients that have in this group and have had a pneumococcal vaccine ever. And it's 1049. Again, I'll fix up the spreadsheet so that you don't have to work out the percentages yourselves. Now I'm going to skip down to who of this 65 plus group has had a flu shot within the last 15 months. I'm going to show you that one. So if I get rid of the pneumococcal vaccine filter, I'm going to leave the other ones on because I still want to stay in this group. And now I want to know who's had a flu vaccine, but not ever. I want to know, give it a tick, have they had it in the last 15 months? So there's this, you can either pick one of these, but I want to know last 15 months. So I can actually select a date range. I only want to know if they've had the vaccine then. So I can go 24 and please no one laugh at me. I'm just going to guess that 15 months is April last year. So since April the 2nd last year to now. And I can see it's just thinking. So of my 65 plus patients, this is how many of them have had a flu shot within the last 15 months. So 1374. Now, just to give you a heads up, there's a whole lot of measures coming up like of my patients that have COPD who's had a flu vaccine in the last 15 months. You can continue to use the same report. So if I get rid of some of these, get rid of flu, get rid of the calendar date, and get rid of the age group, and we're just going to leave on the active, I can move between all these things as I like. So it's got diagnosis here. And it's the same category as you saw on the diagnosis report. I can go and choose the SNOMED code of COPD, give it a tick. There's my COPD patients. What I forgot to do this earlier, but I only want those with an active diagnosis. There we go. And I want to know how many have had a flu shot. Give it a tick. And then I would select my calendar date range. It's always going to show me here what my number of patients are. Now, it's not relevant for this activity, but I do want to show you at any point, if I want to know who those 96 patients are, I can go and click patient list. And bear in mind, these are all fake patients, and it's going to give me the list of patients if I ever wanted to go and invite them to something. I wanted to upload that into Hot Docs. If I wanted to send out an SMS or an invitation, or I wanted to put a note on their file to check something, we can do that at any time. So that's our clinical indicators report. Very powerful. We've only been using inclusion filters. If you ever wanted to, you could actually be excluding certain patients too. You might want to include patients that are on metformin, but exclude those that have got a diabetes diagnosis. And that might highlight to you who's on metformin but doesn't have a diagnosis recorded. I realize there might be good reasons for that, but it might be, you know, that's just an example. There might be other things you want to do. So one more thing to show you before we wrap up, because that should get you through all of those measures. The last thing is asking around of people that have those certain diagnoses we've already looked at, how many are eligible for a care plan? They haven't had a care plan yet. You could use the indicators report. You could, I'm just going to get rid of all of these. I got rid of the wrong one. That's all right. You can watch me go back and find it. So I now want to look at demographics and make sure I've got the 2 active filters on. So you could use clinical indicators. It's going slow for me here. To pick a chronic disease, whether it's a category or otherwise. Give it a tick. And yes, I want it as an active diagnosis. And I could exclude those that have had a care planning item and just type the item in there. Embarrassingly, I don't know the new item numbers off by heart yet. I knew the old ones. I don't know the new ones off by heart, but I could be typing in an item number and exclude those that have had that item number in the last 2 years, whatever it might be. But I'm going to show you another way. So I might just get rid of everything. There's this nice report that we can use to find this information as well. So if I go back to diagnosis, and I know if I don't fix it, someone will say it. Yeah, Sarah, you haven't got your active filters on. I better go do that. Active. Always when you're in front of people that things freeze. There it is. Okay. So I can pick either a chronic disease category or pick a SNOMED text. Let's go with COPD. Oh, come on, we've got 9 minutes. Don't freeze on me now. Okay. Let's go COPD. Give it a tick. Can't really stuff to not having a. And then go to MBS, and there's a report called Tracked MBS. This shows you who's eligible for certain routine items. I've currently got it set to the new care planning item, which is down the bottom here. But it's also, I'm only looking at people with COPD because I've still got that filter on. So it's telling me to action that there are 113 of those patients that have COPD, are active, and are eligible for this item. So 113. And that's what I'm going to go put. How many are eligible? COPD eligible for a care plan, 113. And it will work out the percentage of your total COPD patients. Of your total COPD patients, 81% of them are eligible for a care plan. So it might highlight a specific condition where you go, oh, I really want to make sure that all of our patients that have diabetes do have a care plan, or at least most of them. There's obviously still patient choice, and they may not want one, but that might be a measure that you decide to focus on. Now, I'm not going to go through all of these. I think I've shown you enough of how to use Polar. You will get this recording, and you'll also be offered support by someone here at the PHN to come and sit with you and do this activity. I will keep moving because I want to show you what to do after you've done all this data mining. There's a couple of reflection questions here. So once you've done all of the activity, you can go and have a look and say to us and ask yourself, what looks odd or inaccurate about this data? Is there anything that stood out where you thought, oh, I don't think that's right? And then have a look at, and then have a think through, what could the reasons be? Is it because we're not recording it in the right spot? Is it because we don't do that specific thing at this clinic? Is it because it's not coded properly on the file? And we can help you think through these questions as well. What are the biggest gaps that stand out to you? What surprises you about your data? Might be the age groups. What did you learn about your practice by looking at all your data? And what might you like to change or improve as a result of doing this activity? The next step, once you've done all of this, I promise there's not much more, is to pick something that you've seen, something that might mean something to your team or be important to you. And we're going to get you to be, you might be very familiar with writing PDSAs. You might be familiar with our template, which we're going to provide to you. This template here. So you're going to pick one thing and plan a little quality improvement activity on how you might work on that. Are you going to pick a quality measure and we're going to start being more careful or push with our staff to record allergies or record Indigenous status? Or is it about making sure that we are checking HbA1cs on those diabetes patients? Is it about making sure, let's do a push on COPD patients, making sure they have a care plan in place? And what things could you do over the next couple of months to try and impact that number? So that is the whole point of us doing this activity. And then what we're going to, you might pick several things, but we only ask that you pick at least one. And then you're going to start doing that PDSA. And then you'll come back again in a few months' time, and we're going to do this whole activity again and also review your PDSA to see how you went. I will call out, of course, we're looking for an improvement, but remember, it's really hard to make a big impact on those numbers, particularly in a 2-month period. So small wins are wins. We're looking for the 1% changes. And sometimes a quality improvement activity doesn't work. It doesn't mean it wasn't useful. You probably still learned things out of it as a team, how we work together. what do patients respond well to or not? What's a really hard thing to impact in your data? So yeah, we'll help you do that quality improvement as well. Now I'm just going to swap back to here. So the next steps, tomorrow morning, you're going to receive an email that has these documents. It has a recording of today's session, and it'll be from either myself or someone from my team, that's Tom or Will, where we'll be offering to come and sit with you. We can do an online session like this one-on-one, or you can also just call us if you need to complete this activity, and we would like it submitted by the 21st of August. Sorry, by the that says 21st of August. I think I have 28th of August on the other documents. I'll fix that as well. This has been learning for me as well. But your next workshop is on the 21st of August, which is when we're hoping to have this completed by. There's 2 minutes left. Any questions for me before we finish up? Nope, I haven't kept an eye on the chat, but I assume my lovely colleagues have. Thank you. All right, thank you for coming along. It was a great turnout, and expect to hear from us tomorrow with that workbook, your activities, and the offer of any support that you might need from us. Thank you very much for coming. See you all on the 21st or before then. Thank you.